thank you for being here. Thank you for spending time with us on this very important subject. This is called Navigating the Local Landscape. How can you help? This is such important subject matter. My name is Timber Smith. I'm a community member, what I also like to call myself, and not really using titles, but I am the People's Podcaster here in the Kosh. And I am honored to be here with you today. In this session, what we're going to do is we're going to have local experts who will highlight drug and overdose trends from recent years in Winnebago County. The data will highlight the complexities of our local landscapes and the urgency of the work that needs to be done here. And after we're done with that part of the data, we're going to hear from our local resources. Resources where people can find the assistance that they need no matter where they are in their recovery journey. You ready to jump in?
Yeah.
Awesome. Okay. What I want to say first is, I can't tell you how special it is to be here with you. This group of people feels amazing to me because of the honesty, the vulnerability, and there's a trust. You don't walk in many spaces where there's this trust. Recovery work is important because it's community. And community doesn't have boundaries. Community is all of us. Community is neighbors. Community is friends. Community is relatives. Community is family. And community is us, most importantly. So, I've heard this said multiple times, and this really had power to me, is that substance abuse or disorders, they have no age, no gender, no race. It affects all of us. Solutions are complex, but the one thing I've figured out by being here is it takes a village. So thank you for showing up today in this recovery village. All right, you ready? All right, we've got 6 amazing representatives, and we're going to start off first with Sarah Jean. We're going to start off with Sarah Jean.
Thanks, Timber, and thank you for those introductory words about community. I think that's really important and a really great way to kick off our session. So my name is Sarah Jean Schlarterman. I know it's a long word, so it's okay. I'm an epidemiologist with Winnebago County Public Health, and so with our session today, I'm going to start out with sharing some data about overdoses in our community. I promise I'll keep it brief, because not everyone loves data as much as I do. So, unfortunately, overdose deaths are increasing. Last year, we lost 47 people to an overdose. This is a trend that we're seeing locally, statewide, and nationally. And when looking at the substances that are causing these deaths, you can see that opioids are by far the primary substance, specifically synthetic opioids such as fentanyl, and that has just skyrocketed in recent years. What's really unfortunate with fentanyl is there's so many people that are using fentanyl unintentionally, that it's being mixed in with other substances, and they don't even know that they're using it. And so looking at last year's data, fentanyl contributed to 31 of the 47 overdose deaths within Winnebago County. Most of the time that fentanyl was also mixed with other substances, so that wasn't the only substance that was the cause of death. And then cocaine is the second most common substance that we've seen in our community contributing to overdose deaths. So I know this slide has a lot of information, and I'll walk you through it. So one thing that we do in public health oftentimes is look at the geographic breakdown of where diseases are happening. And so that's what this graph is showing. In that table, that first column is the geography, what cities or towns we're talking about. The second column is the number of deaths. That third column is the death rate, and the fourth column is population. So in public health, we often use rates to talk about things across different population sizes. It just allows us to have an easier way to compare across different size populations more easily than looking at counts. And so with rate, that would be the number of deaths divided by the population times 100,000. So hopefully that helps you all understand that a little bit better. When looking at the count of deaths, the city of Oshkosh across the past 5 years has accounted for more than 50% of the overdose deaths. But when looking at the rate, city of Neenah is pretty close to the city of Oshkosh. And also looking at the portions of the city of Nasha and city of Appleton that fall within our county border, those also have a disproportionately higher rate compared to our county as a whole. So this just allows us to think about where we might want to focus some of our prevention efforts, and focusing in Oshkosh for sure, but also throughout the county is really important. And so another thing that we've been trying to get a better sense of is the non-fatal overdoses within our community. This is still data that we're digging through, looking at all the different sources because it's really complex. What you see on that graph is the non-fatal overdoses that have happened in our community related to EMS records. So if someone had a non-fatal overdose, a family member gave them Narcan, brought them back, and then either they were fine, didn't need to go to the hospital, they didn't call 911, those sorts of situations would not be counted in those numbers. Or if someone was brought straight to the emergency room and there was no EMS interaction for that overdose, those situations also would not be included within the counts. So it's just part of the data. It's stuff that we're still trying to look at and get a better sense, but it does tell us some of the story. So across the past 5 years, there have been 800 reported non-fatal overdoses within our county, according to EMS records. And that number is decreasing, as you can see on the graph, while our fatal overdoses are increasing. And like I said, that's just part of the story, but it's something that we're trying to dig more into to get a better understanding. And so looking at our overdoses, both our non-fatal and our fatal overdoses, we have looked at the age breakdown, and that 30 to 39 age group is definitely something that we need to focus on, as well as the 20 to 29 age group. Those are by far the two highest age groups where non-fatal and fatal overdoses are both happening. And then lastly, just looking at the breakdown by sex, there have been more overdose deaths among males compared to females in the past 5 years for both fatal and non-fatal overdoses. This is just a snapshot of the demographic information and the details that we're trying to look at for both of our fatal and non-fatal overdoses, trying to think through how we can work on prevention efforts with these populations. So there will definitely be more to come with all of this work. We're still analyzing the 2023 overdose data. So when we have the annual report later on this year, you might see some of the same data show up in there, and you'll probably see some new data that we're trying to just get a better understanding of as well.
So, based on the data you just presented, what are some of the things we should be keeping our eyes on?
Yeah, thanks for that question. Fentanyl is definitely the thing we need to focus on right now.
With all of this data, including some pretty surprising statistics, what does the health department have to offer in terms of hope?
That is also an excellent question. Thank you. So the health department does have a harm reduction program. It's been in place for a handful of years now, and we have expanded what we provide to the community across the years. And so looking at the 2023 data specifically, we served over 1,000 individuals through the program, getting a variety of different resources. And that program often works with people that are actively using or family and friends of people that are actively using. And a big focus of the program is meeting people where they're at, helping them stay safe and healthy and alive until they're ready for those next steps. And then they can get connected to resources, get connected to treatment. We have a fantastic harm reduction coordinator who just has a great relationship with the people that go through the harm reduction program, and she's able to have some really personal conversations with them and hopes to get them all into treatment when they're ready. And so last year we provided nearly 2,000 fentanyl test strips to clients, and we started offering xylazine test strips to clients as well, just so that they can test the substances and get a better sense of what's in the substances that they're using. We also offer Narcan to the community, so whether that's people that are actively using, friends, family, organizations. And so last year, nearly 900 boxes were distributed across the community. And within the program, we do ask clients to report on how they use Narcan. And through those questions, we found out that 201 lives were saved by Narcan last year. And so that's why it's so important for everyone to have Narcan. It's important for our harm reduction program to be able to provide that to the community so that we can do what we can to keep saving lives.
Thank you, Sarah Jean. All right. Next, we have Amy. Once again, I'm just trying not to throw out any lessons. Hello, Amy. How are you doing? Nope.
Hello? I'm good. My name is Amy Jeffers. I'm the supervisor for the Connect program or the clinical diversion team. We are located in the same building as the DA's office. And then I'm also going to speak about State Street Center, which is a collaborative space where individuals can come and just talk and hang out and do that stuff. Our mission statement is to bridge gaps and foster connections, ensuring every resident of Winnebago County has access to essential resources for substance use, mental health, housing, and any other area they may need assistance in. Connect is a safe place that empowers individuals in and out of the justice system to thrive and give back to their community. We serve the residents of Winnebago County. Because we are human services, we need to stick to our county. But that is people through maybe the justice system or just walk-ins or whatever it might be. If somebody comes in that's not part of our county, it's not that we're going to turn them away. We'll get them papers and resources and whatever they might need. It's just that we can't fully service them and case manage them. The programs we have quite a few with the Connect Space. We have jail reintegration. We have a sub counselor located in the jail where she does assessments and also does some programming there. She also helps with reintegration into the community, getting them set up with anything that they might need upon release, like health insurance, social security, anything like that, as well as mental health. She can put a referral into our human services building if need be. We have SUD services. We have teen court, which is for teens age 13 to 17, that they can have a jury of their peers kind of decide their case if they get a ticket. And all the volunteers are also there, so we're always looking for volunteers. We are starting mental health court in April. It's going to start out slow with just 2 people, but hopefully that will go well and we can increase that. Drug court has been around since 2005, I believe. That is a great program for the community. A lot of the participants in drug court end up giving back and doing a lot for the communities. We have a peer support specialist. We have DHS diversion is when we work with the DA's office to help those who might get themselves in some criminal charges. But instead of maybe charging them with that, they have an opportunity to do a diversion where they can do a program for, say, 9-12 months and get it off their record if they succeed. Safe Streets Resource Team is just a team that is for anyone who might need resources. They can come in that way. We took over the 24/7 alcohol and drug from the Sheriff's Department about roughly 2 years ago. And then SOAR is the DA's office's grant, where it's like kind of like a mini drug court type thing where they have court on Fridays and they have to go through this intense program for 9 months and then have the opportunity to get that off their record. In 2023, we had 888 new enrollments. In total, so some carryover for 2022, we had 1,160 total clients served. Some of those clients come in every other day for UAs or whatever it might be, so we're always busy. Just a little difference between when the Sheriff's Department had the 24/7 programs versus us. When we have a compliance rate of about 81% right now for the alcohol compliance, and for drug we have about a 63% success rate, or compliance rate I should say. The Orrin King building is located at 448 Algoma. We're open Monday through Friday from 8 a.m. to 4 p.m. We can help people find services or resources. We attempt to reduce further justice system contact and get people back on their feet. And it's open to any resident, like I said. And then State Street Center, it's at 206 State Street, so it's right connected to the CAB building, if anyone's familiar with that. It's open Monday through Friday from 9 a.m. to 3 p.m. It's a space to socialize, participate in activities, attend groups, etc. You could just stop in there. You have to sign in so they know who's there, but it's a space for anyone. Clients are able to sell, they have a craft fair at least twice a year, if not more, where the clients are able to sell their crafts and kind of earn some income that way. And then they also help in the community with doing trash pickup and stuff like that. So.
Amy, can you share a little bit about what's the difference? How does drug court differ from regular court?
Well, drug court is intense. When you start the program, you're going to court. It's on Thursdays. You go to court weekly in front of the judge and the drug court team, and they kind of just go review their week and what they've done. And throughout the week, they have homework to do, and they have to get themselves a job and housing and treatments, number one. and that kind of thing. Where regular court, they can go in front of the commissioner or the judge, and the judge or the commissioner kind of tells them what they have to do, but then they're on their own, so to say, after that. Where drug court, we are a helping hand throughout the whole process.
So there's like a set of steps, and
Yeah.
you're kind of helping to manage it
Yeah.
step by step
Yeah.
instead of like huge leaps.
Yep.
Okay. Can you share a story with our audience that helps us understand the impact of your organization?
Sure. I have been thinking about this, and I was going to do one story, but I thought there's so many neat things that happen in our space. Connect probably started roughly 4 years ago, but we've been into our like official space 2 years, and it's just the amount of people who just stop in, and if they know they need something, they know that they can reach out to us and somebody will help them. We're a small enough space where everybody knows each other's clients and whoever might be coming through the door, so they just feel comfortable with everyone. We've helped with housing and treatment and insurance, and it's just nice to see somebody who's struggling in active use come in and say they need an assessment, and then find that for them and get them into treatment, and then follow through with them and see that they're giving back to their community. So,
Is there anything that the community can do to be helpful?
no, I think just get the word out about definitely the State Street Center, so that if there's people who are struggling or maybe kind of isolate themselves or whatever it might be, it's just that's a great place for them to kind of get out and comfortable and just talk to people that they might not have ever thought to talk to. As far as the Connect space, just let people know that if they need resources or whatever, they can stop in there and we'll help them.
Thank you, Amy.
Thank you.
All right, next up is Carrie. Hi, Carrie.
Hello, good afternoon.
Good afternoon. Oh,
I'm not Trevor. Trevor, do you want to go next?
yes. They were in order. Well, let's welcome Trevor to the stage.
That was awkward.
Well, we're not perfect, right?
No, it's all good though. I'm not perfect.
No,
That was probably my fault. I don't know.
You can blame me.
I will.
All right. Hello, Trevor. How's it going?
Good. How are you?
I'm doing well.
Good.
All right. Trevor, can you please tell us who you are and explain about your organization and your program?
Sure. Yeah. So my name's Trevor. I work at Solutions Recovery here in Oshkosh. I'm also a person in long-term recovery. Some of the programs that Amy was just talking about, drug court being one of them, I successfully completed that. So just really grateful for all of the resources that we have in our community, that being one of them. So Solutions. So you want to know about me, right? And then you want to know about my organization. That's what you said. Okay. So Solutions is a magical place. And it's a place where I have a really personal connection with, because I got started volunteering there back in 2015 when it was a requirement of the drug court program, and I got to become involved on many levels throughout my personal recovery journey. But Solutions is a safe place for people to go that are struggling with substance use disorder, or who have a loved one who's struggling with substance use disorder. It's just it's something really it's hard to explain, and with the new space that we have, it's become just so much better, more welcoming. But it's a safe place, and it's a substance-free place for people to go, which is huge. We're a recovery community organization, so we do a lot of things, and we've grown to be able to do a lot of things as a result of what our community said they wanted. Because at the end of the day, as a nonprofit organization, I believe that we're here to serve the community, and our mission is to support and empower those that are impacted by substance use disorder, or drug and alcohol addiction. And how we do that is through programming. There's a lot of different things that we get to do that are kind of under the umbrella of solutions. So one of the main thing that I touch base on is the Recovery Community Center. It's open every single day of the year, from 8 in the morning until 8:30 at night. And some nights, like, they stay open later for like game nights and stuff like that. So that's really cool. And it's that portion, the Recovery Community Center, is run 100% by volunteers. So we have a coffee counter that used to be in our basement, and that was really fun, and it was a great place, and it was a safe place. But most recently it's moved into the ground floor welcome center is what we call it. So people can walk in, they're greeted by a member of our staff, and then they're also greeted by a volunteer working at the coffee counter. We have snacks, beverages, just stuff like that. And it's a really cool place to socialize. We have game nights or game days there. And there's a lot of things that are kind of tied in with that. One of the, I guess, big draws and where we get a lot of our footprints is the support meetings or groups or the folks that meet there on a regular basis. So we've got over 30 support groups that happen per week. And since we've increased the space, it fills up. So like any night of the week that you go, so Wednesday night is a really good example. Like, it's lined up. We got yoga, we got meetings, and the space is completely full. And that's so great to see, because like recovery happens there, you know, like people come in sometimes like at the beginning of their journey, and then there's people there that have been there for like 20 years, you know. So before Solutions was even accepted, and this is kind of what's cool, is we have an Al-Anon meeting that meets at Solutions, and they have been meeting in that building through all of its transitions for like 40 years or something like that, since the 80s. It's like, that's amazing and unreal, and like so cool to have that history there. But that's another big piece of what the Recovery Community Center is. We have our peer support team that is there anytime we're open now too, which is kind of like a relatively new thing. And we offer childcare during our peak meeting time. So most evenings we have a childcare provider on site, and it's just removing barriers for people. Like, that's the big thing. And that's why we exist as Solutions. It's like, how do we remove barriers for people, and how do we even know what those barriers are? We work really closely with our health department to have listening sessions. I didn't know what a listening session was like 5 years ago. So now I know what they are. We facilitate them regularly for people in recovery and for people that aren't in recovery, you know, and we listen to our community, because that's really, really important. So childcare was one of those things. Transportation was another one of those things. This event came out of a listening session, so that's kind of cool, right? So most notably, those Solutions is a safe and welcoming place. And it was cool to hear Lori Palmieri talk about earlier, like, that she's heard that it's a different space, because it really is. And if you haven't been down there, please come down, because it's really, really cool. We also have a housing program, so we have just about 45 beds for sober housing in our community. And I don't know, but yeah, there it is, it's up there, and I just want to make sure I'm on we've been able to expand that program substantially just based on the need of the community. I wish I could say that our houses are empty because that means the need doesn't exist anymore, right? But they never are. We're consistently serving people. We consistently have a wait list. And it's really cool to be able to like see the transformations that happen through that as well. So again, we sometimes see people come in at, day one, and seeing people come in and maybe they're really broken, they're hopeless. To be able to see their transformation, their journey through the sober living program has been really, really amazing. And what started as in 2015, we had one home that served 4 women, and now we've got 8 homes that serve about 45 folks. So, and that's, we've got 2 women's houses, 3 men's houses, and then we've got 3 graduate houses. So those houses are for folks that have completed the primary program, which is typically 6 months, and from there, if they've done well, completed our program, and are committed to kind of sticking around, they become members of our community, and a big barrier that a lot of our folks were having when they were completing our program is they couldn't find safe, affordable housing anywhere. They go through sober living and then maybe they got to move into some less than desirable areas because of the rent is cheap there, or maybe even having to return to like an unsafe living situation. So we wanted to create a space where they didn't necessarily have to do that. And it's worked out really well. And we're hoping to, again, expand on that sometime in the next year or so.
How does someone find solutions?
We are located at 621 Evans Street. So most people, if you're from Oshkosh, a lot of people don't know like that we exist, and I think like more and more people are hearing about us through some of our outreach efforts. But we're just kind of tucked away in the Menominee South neighborhood, really close to the park. Evans and Parkway.
Yeah, I always thought that was a church.
It used to be a church. There was a church there. Yeah, and so we're in like the old school portion of the church.
But what I really am asking is, if you are somebody who needs the services of Solutions, how does one in the community learn about Solutions?
A lot of times it's word of mouth. We try and do as much outreach as we can. And there's with our newest program, we've been able to expand our outreach capabilities and really be kind of that space in our community that people can go to. So that kind of brings me to our peer response team. So we started the peer response team in September of 2022. Yeah, I think so. And because it's been about a year and a half now. And really that was born of this idea that our community wanted to have like a rapid response model. So it was born out of a recommendation by the Overdose Fatality Review to have something that would respond to overdoses immediately if it was necessary. So it was really interesting having the conversations with Jennifer and some of the health department staff on like what that could look like. And I remember being a part of that process of where do people in our community go that are experiencing substance use crisis in the middle of the night or at any time of day, right? So the answer right now, sort of, is many times they end up in an emergency department. So that's one space that typically, like, I know I ended up there, like, many times. Like, I want to be done, and I don't know how to be done. So, like, what do I do? So, like, I guess a part of that is, like, solutions and, like, recovery kind of bridging into the broader community. And that's, like, a lot of what this recommendation was about, like, how do we bridge recovery and all the amazing services that we have in our community. And like that's what the peer response team has done for us, is like allowed us to show up at like all the tables and let people know that we're here, we exist, and like long-term recovery starts with many of these partners many people that are in this room, right? Like treatment centers, hospitals, law enforcement, all these places where typically people like me end up. Like we can facilitate that connection. We have many different means on which people can find us or reach us. A lot of it is through referral, though. That's like typically where we have the most people coming in is through our agency partners, which is really, really great. It's cool to see.
Trevor, can you share a success story about why this program matters and what impact you've seen it have?
Yeah. I don't, like, how much time do we have? I don't know. Because, like, man, I get to see a lot of cool things on a regular basis. Again, we see people come in at their lowest, and like most notably, so like we started working in the jail recently, and it started with our peer response team just going in and meeting with inmates, essentially. That was a place where many folks in active addiction end up. I was there, so I can say that in my personal experience. So there's one particular success that really sticks out to me when you ask me that question, when I think about like the most recent work that we've been doing. And like what I can say, I'm gonna try and stay on track here, but like all of the staff that work at Solutions are in recovery, so like they're all miracles, right? Like they all show up for the community, and like I get to see that on a regular basis. Like it started with like when we were all volunteer ran, like all of our volunteers are in recovery, and like that's not 100% true today because we have people that don't identify as in recovery, but they're part of the broader community and they want to be a part of what we're doing. So they volunteer, but all of our staff are in recovery. They show up, they live this mission, and like that's one piece of success. But when you talk about like a specific case, I remember one of our staff was working with this gentleman who he met through our jail program. So he was receiving peer support in jail. And so like that looks like all of these things that are out here. We'll meet with inmates regularly. We do release planning, and part of that release planning was he was going to treatment. And I remember this particular recovery coach is not able to drive under our insurance. It's sometimes just a thing that happens. So he asked if I would help facilitate the transfer. So we picked this guy up from jail and we took him to treatment in Appleton. And just the conversation that I got to have with this guy from jail to treatment was like, all right, I don't know, we'll see where this goes, right? And I remember being in that space, so like just being able to relate, and I think a big thing that been talked about earlier was like empathy, right? And like being able to relate and say, hey, I've been there. So this guy went through treatment, he came back, he did sober living with us, he became one of our senior peers in our houses, and then he successfully graduated the program, and he is just a light today. And he shows up, and he, like, when we reach out to him and ask him like if he wants to be a part of something, he says yes, and he continues to show up. And he's got his kid back, and he can, like, those are the cool things that I get to see on a regular basis, is like people transforming their lives. Like truly, like starting with nothing. Like you come in jail, and like sometimes, many times, don't have stable, supportive, or housing at all, right? And a couple years later, like you're going, like a year and a half later or whatever, like you're doing this work, and it's just really cool to see that and see that happen, see the success.
All right. Trevor, thank you.
Yeah.
Hey, let's click the slides and see who's next.
Okay. We're available 24/7 via this hotline, and we're also reachable in the We Heart You app that you all downloaded today, I'm sure. So Carrie is actually next.
All right.
This time.
All right, I'm back.
All right. Hi, Carrie.
Hello.
Sorry about that.
That's okay. We're winging it. It's fine.
My bad.
No problem.
All right, Carrie, can you please share a little bit about yourself, and then let's start talking about your organization.
Yes. So my name is Carrie Cabasta. I am with Theta Care, and Theta Care Behavioral Health to be more specific. And we have a lot of different programs and services in behavioral health, but I'm here today specifically to talk about one, which is our behavioral health walk-in care clinic. So we are located in Neenah on Green Bay Road. Monday through Friday, 8 to 4:30, we're available. So really, what could somebody expect when they come to our walk-in clinic? I think many of us are aware or maybe have personally experienced the all too familiar wait list for services. And so really the purpose of our walk-in clinic is to be available to anyone in the community that needs services when a wait list is not an option. So you don't have to be a patient of Theta Care, you don't have to have a Theta Care physician, you don't need a referral. Our walk-in clinic will see any member of the community. We also really don't want insurance and finance and some of those other things that sometimes are barriers for people seeking treatment to be an issue. So Theta Care does have financial assistance available as well. So when somebody comes to the walk-in clinic, they're going to meet with a member of our care team that's going to ask some initial questions to kind of get them on the path to what might be the most appropriate next step. We do have licensed mental health providers. We have substance use treatment counselors, and we also have a psychiatrist that are located at our walk-in clinic during those clinic hours. So depending on what the person might need, they're going to meet with a member of that team. And so for substance use treatment, we do currently have all of our intake assessments for substance use treatment occurring at the walk-in clinic on a walk-in basis. We do schedule some in some of our other locations, but for the Fox Valley area, really anybody can go there Monday through Friday. They don't have to make an appointment. They can walk in, they can do that comprehensive intake assessment, and we can get them connected to treatment, usually within the same week, sometimes even the very next day. They can meet with a mental health clinician, get on the right track from that perspective, and then if it's appropriate, our psychiatrist can see them too, and sometimes talk about options for medication. So
when people use the term mental health, I figure like it's so broad and it's hard to narrow down. And so when you say mental health, what are some of the types of mental health challenges that you see walk through the doors?
yeah, that's a great question. I think a lot of what we see at the walk-in clinic is people might be experiencing something that has occurred recently, right? That might be creating some significant anxiety or distress in their life. Or they're just at a point where they've been, dealing with things for long enough that they are ready to ask for help, and making that phone call or getting a referral and then waiting months and months potentially to see somebody is just really not an option. So it is very broad and could be many things. It means many different things to different people too. So,
do you have any organizations that you partner with also?
Not necessarily that we directly partner with, but we have a lot of, we have multiple different programs. Like I said, we have we have outpatient substance use treatment, we have intensive outpatient substance use treatment, we have traditional outpatient psychotherapy. We have medication management through our psychiatrists. We have a mental health partial hospitalization program. We have our inpatient psychiatric unit located at Theta Care Neenah as well. So we do have a lot of services within Theta Care, but we absolutely work with other agencies that might either have sooner availability or just might be a better fit for that particular person. Maybe it's closer to where they live, or could be any reason that they may need to get connected somewhere else.
Okay. Carrie, can you please share a success story?
Yes. I think I have one more slide before we get to
Oh,
the success
sorry
story.
about that.
Important pictures, just to kind of put. So I think sometimes it's important that sometimes it can be nerve-wracking for people when they're going into a place and asking for help. So one of the things that's really cool about this space is that it was not designed for behavioral health at all. But we've really taken it and ran with it. So as you can see, it's pretty light and very, very open. We have a lot of floor to ceiling windows and really try to keep the space bright and cheery. So the sun just shines in so many ways from a beautiful perspective. So we try to not make it look so much like we're co-located with an urgent care clinic. So it does definitely look like a hospital and a clinic, but we try to just make it really friendly and not scary too. So in terms of the success story, I think I can think of just multiple situations where a person has been able to to be able to get connected to and scheduled for substance use treatment, and maybe start to deal with their depression, anxiety, and even work with a psychiatrist to get on medication in the same day, which for some people that journey is years. So it's just been really, really cool to see that, and also because there's multiple other different types of clinics in primary care in the other part of the building. We've had situations where a patient just shows up for, their annual physical, and there's some things that they're discussing with their doctor and they're concerned, and the nurse or a medical assistant or a member of the staff has said, hey, I'd really like you to go down to the walk-in clinic, and sometimes they've walked them down there to just say, hey, here's this, and kind of do that warm handoff. Those types of connections have just been really, really great.
Where do people go if they need help, and who do they contact?
Yeah, that's a good question. So again, we are located, and I didn't put our phone number on here, which is a little silly, but I didn't realize it until this morning. So we're located on Green Bay Road, Monday through Friday, 8 to 4:30, and a person can just walk in. Again, they don't need an appointment. It's a walk-in clinic. Don't need a referral. In general, in any of our brochures, we do have one phone number for behavioral health. So that phone number is going to get a live person on the phone too that can help navigate or give instructions or figure out where the person needs to be if needed. So.
All right. Thank you, Carrie.
Yes.
There we go. Okay. Hello, Amber. How are you doing?
I'm well. How are you?
I'm doing well. Can you please share a little bit about yourself and your resource?
Yeah, absolutely. So my name is Amber Wilkie. I am a person in long-term recovery. I'm also a substance abuse counselor with Collaborative Wellness. All right, here we go. So Collaborative Wellness is an outpatient mental health and substance use disorder counseling service. Again, outpatient. I'm here to highlight today the newest of our locations, which is at 502 East New York Avenue. And our hours are by individual appointment. However, the service I'm really here to talk about today is the dual diagnosis group, which is from 10 to 11:30 on Tuesdays and Fridays. So our mission is to cultivate growth and wellness through connection with individuals, families, and organizations. So we serve individuals affected by mental health and substance abuse throughout their lifespan. We're a team of 12 individual clinicians who each practice different modalities. We do accept most commercial insurances as well as Medicare and Medicaid. So there's the puppies. So something that's really important, when you walk into collaborative wellness, our clinicians take pride in really trying to make it a safe, comfortable atmosphere. When you walk in, there's couches, you can grab yourself a cup of coffee. We really invite you to go to the fridge, grab some water, and just spend some time with whoever else is there. We have a wide range of services from the structured insurance-based groups to the free drop-in groups, and some of our clinicians practice the EMDR, brain spotting, bilateral stimulation, and again, often work next to those therapy dogs. I'm sure you guys saw Griffin and Gus wandering around, but if you haven't stopped by them yet, make sure you step over in the corner and say hi to them. They're great. Okay, so the highlighted services available. So the New York Avenue location is where most of or all of our substance abuse groups are. And again, the dual diagnosis group, what's great about this group is it's a drop-in group. So it is absolutely free. There's no intake, there's no appointment needed. If you're in need of a service, we encourage you to just come in. Again, that's on Tuesdays and Fridays from 10 to 11:30. We also offer insurance-based groups, which are the outpatient substance abuse groups. Sandy Schaefer has and runs that on Mondays and Thursdays from 3 to 4:30. And then we also have a women's recovery management group that I run directly after Sandy's group, which is from 5 to 6:30. We work really closely with the residential treatment facilities as well as sober living, drug court, and many other community providers to really make that seamless transition for people coming out of residential treatment to get right into services. And I know a lot of wait lists exist and people are waiting to get into treatment, which is why this dual diagnosis group is so great, because while they're waiting to get into service, they can come in and at least have something available to them. All right, so where to start? The best way to reach us is to either call or go to our website. There's a little, I don't know, is there a clicker here? Get Started tab in the right-hand corner of the website, and then we just ask that you fill out your information and anything specific that you might request during therapy. Say you're interested in the EMDR or substance abuse.
Okay, 2 questions I have. You said the term dual diagnosis twice. What does that mean?
Yes, so dual diagnosis is going to be mental health and substance abuse. So one of the main goals is to really bridge that gap, because a lot of times clients will come in and they'll have to get help for mental health, but they'll also have to get help for their substance abuse services. So we are all in one space.
And there's an acronym that you've said a couple of times, and I don't know if I'm going to get this right, but was it EMDR or was it MDR?
The EMDR, yep. So some of the clinicians do that. There's a wide range of ways that they can do that. There's
What is it?
license, so it's a modality that's used. There's the light bar that they use, and there's also the bilateral stimulation, so little buzzers that go on your arms. It's really effective with people with severe trauma.
Okay, awesome. Okay. Amber, can you share a success story from your organization and what kind of impacts that has had?
Yeah, so I actually brought a letter today. The dual diagnosis group started in 2021, and it was originally made possible by a grant and then was carried over by local donors. So this is from someone that has been a part of that group. I've been a part of the dual diagnosis group at Collaborative Wellness since April 2022. This group is in an inviting setting with a sitting area in the lobby, as well as coffee and water that is available at no cost. I have made several connections within the group, and we are able to support one another outside the group setting. I work as a peer support specialist through Winnebago County, and bring clients to the group, and they are able to make connections as well. We learned about mental health, substance use, and how addiction has affected the brain, as well as chemicals in the brain like dopamine and serotonin. Art therapy helps us to use the creative side of our brain and step out of the logical thinking during this time. The therapy dogs at group help us to connect as well as help us during anxious or emotional times. The individual therapists are able to meet us during group if we are in need of extra support. I am so appreciative of this group as it has helped me my growth in recovery and helped me learn more about my own mental health. Thank you so much for your time and donations, as I have found a safe place to be myself.
Awesome. Thank you for sharing.
Thank you.
How many treats do the dogs get a day?
They get so many treats, it's ridiculous. There's someone who actually comes into group and brings beef jerky with them, so they enjoy that.
All right. Can you?
Yes.
Thank you very much.
Thank you.
Hi, Jamie.
Hello, how are you?
I'm doing good. Tell me these chairs aren't fantastic.
They're pretty.
Feels like Oprah.
These are pretty awesome.
Yeah, these are pretty awesome. Jamie, can you please share a little bit about yourself and your organization?
Yeah. So I'm Jamie Simon. I am the clinical supervisor for Rogers Behavioral Health, our Appleton location for our co-occurring substance use and mental health service lines. I supervise the clinic in Appleton, also clinics in Sheboygan and Madison. And so I want to explain a little bit about our level of care, because before I started working for Rogers, I didn't understand what that looked like. So we have partial hospitalization and intensive outpatient levels of care at our Appleton location. So partial hospitalization is 6.5 hours a day. Our intensive outpatient is 3 hours a day. And we really emphasize the continuum of care at Rogers. We know that it's a process, it's a journey. You can't just go to one treatment and then expect you're going to be, good to go for the rest of your life. So when we have folks coming in, we assess what their needs are. Our clinical admissions team does that, and we get you into the level of care that we think is going to be the most successful based on the ASAM clinical standards to help us make that determination. And then we want you to follow through that pathway. So you might start in our PHP program, complete that, step down to IOP, and then we want to get you set up with an aftercare, an outpatient treatment program when you leave Rogers. I know we're here to focus on resources within the Valley, but I also want to talk about a couple of different locations that we have that are available. Sheboygan has a clinic that's been operational for about 3 years now that has similar services to what Appleton has. So if we're talking about some folks maybe from the Fond du Lac area, we've had folks make that commute and come to the Sheboygan clinic. But in addition to that, we also have inpatient hospitals and 2 residential treatment programs in the Milwaukee area. So we really want to get people to that right level of care. We can step up, we can step down, we can get people where they need to be, where their recovery is at any given point in time. I also want to add that our Sheboygan location, through a generous community donor, was able to build a supportive living facility where patients can come and stay and live there while they're receiving treatment. So if they're in a housing situation that's unsafe or unstable, they can come, we can get them into something maybe more stable after they leave care with us, and that has been a really excellent resource for our patients. You can self-pay for that, and we also have grant dollars to get folks into that environment, which I think is really, really wonderful. So you can see here our mission. I'm not going to read that for you because I think you can all probably read it on your own. But I want to talk about who we serve. So we focus on adults with the co-occurring dual diagnosis, mental health and substance use. I think the co-occurring piece is so important because we know that addiction does not exist in a vacuum. It co-occurs with anxiety, depression. We also know evidence-based treatments and research tells us that we need to treat it at the same time. If we try to do it separately, we're not going to have as good of outcomes. So we absolutely want to take care of that effectively. With that also, Rogers is not just a substance use treatment organization. We treat all sorts of mental health. We were actually grown out of OCD treatment. That's kind of been historically Rogers' primary service line. So one of the things we do with our substance use treatment folks is if they don't get the mental health care completely in our service line, we can move them over to another mental health treatment line if we need to. Trauma is a big one we often transfer folks to. We get them stabilized, we get them coping skills, we get them some recovery, and then we move them to a program that can really target the mental health needs that they have. I don't have it on the slide, but we do also treat adolescents for substance use and mental health diagnoses. Not quite as common in our clinic, but it is there. We do accept most commercial insurances, including Badger Care, state insurance. Our care coordinators, when you call in, they're going to do a great job of working to get through the barriers of treatment. So if we have somebody who's coming in who's maybe incarcerated and we need to work with the probation agent instead of the patient, our care coordinators are going to do that. We're going to help break down some of those barriers of cost. And I forgot, I need to cycle back and talk about one more service that's new that we have. Historically, Rogers has not done a lot of outpatient care. We are, however, moving into virtual psychiatry services. So anybody in the state of Wisconsin can get a referral, use our connection, which I'll talk about a little bit later, and get in to see a medication provider. We know there's a huge shortage of those services, so we're really excited to be able to offer that for folks within the state of Wisconsin. So I have a picture of our facility, and I want to just emphasize that all the pictures that you all have shown gives me so much hope, because this population has typically not gotten nice stuff, right? You know, we kind of get the donations, the hand-me-downs. All these pictures of these facilities are simply gorgeous. And that gives me so much hope, because one of the things I hear from patients is, I just never felt like I mattered until I walked in the door. And that's something at Rogers we really want to counteract. It kind of going back to what Vin talked about, and you matter. We want our patients to feel like they matter. We want to meet them where they're at and really have a safe space for them. So to see all of these inviting images, it really does warm my heart that we are doing that. So as I talked about, we want to be really collaborative with our patients, meet them where they're at in terms of their recovery, and I'll talk about that a little bit more later. But also want to emphasize that at Rogers, we really use evidence-based treatment. We want to use that research-based treatment that we know works. We have a 3-week rotation of material that we go through with the patients, and we really just use what works, so motivational interviewing, CBT, DBT, those kinds of things.
I'm going to ask if there's another slide.
Just the contact slide.
Okay. I just wanted to be sure. Can you share your story with us at this time?
Absolutely. So kind of, as Vin was talking about the whole concept of we matter and feeling welcoming and inviting, our philosophy, the philosophy that we use, is we want to create a space where people feel welcome. We all know that recovery oftentimes takes 3, 4, 5, 6 attempts to be successful. And one of the missions that I have and that I try to instill in the staff that I work with is to really encourage that welcoming space, a safe place. Maybe you're not ready for recovery at this moment in time. Maybe in 6 months you will be. So if we can meet you where you're at, create a space that feels safe, you might come back. And I think about a story of a young woman who has been through our treatment regimen a handful of times. And she came back to us recently. She found out she was pregnant with a high-risk pregnancy. Baby has a lot of medical issues, and she had a relapse. And she thought to herself in that decision point moment, I can go back to using and go down that pathway, or I can go back to Rogers where I know I feel safe. She came back, she's working the treatment program. We have actually adjusted our standard treatment care so that she can go to Milwaukee a couple times a week to get the prenatal care that she needs. And I'm really hopeful. It's a tough situation. This young lady has a lot of barriers, but we're going to be there beside her through that, whatever the outcome is going to be for her and her child. And that's just that sort of story, and that's only one. I have lots of examples like that. I think that's the success and what we want to create with our services.
All right. Thank you, Jen.
Can I talk about one more thing really quickly?
Of course you can. Wait, of course you can.
So I have it up on the slide here. There's a couple ways to access treatment. We have a screening number that anybody can call 24/7, right, Lisa? Yep. Also through our website, there's a screening option. What is going to happen is you're going to get set up with a screener. You're going to provide information to them about where you're at, what your needs are. We're going to run that information through our clinical team. They're going to make a recommendation for treatment, and then we're going to have a care coordinator who will walk you through that whole pre-treatment process, clear out insurance, get you scheduled, and then you're jumping into treatment. We've definitely streamlined that process within the past year to reduce those barriers, because barriers certainly are out there for folks.
Thanks.
Yeah.
Okay. All right. At this time, can I get a round of applause from the resources? Do we got time for questions? Okay. Cool. All right. I'm going to come out with, we got time for some quick Q&A, and I'll come out with a microphone, and you can ask who you would like to ask.
So I know this is my lens as a physician, but for opioid use disorder in particular, the opioid agonist treatments, methadone, buprenorphine, Suboxone, are the gold standard for preventing overdose, reducing overdose death, and the other complications that come with opioid use disorder. Can you explain how in your programs you're either providing those services or facilitating connections to people who do?
I can start with what we do at Rogers. We have physicians that are part of the treatment team, so we are working collaboratively with patients to either maintain that, get them started on those treatments, and support them in finding long-term care after, because that is so critically important.
We have direct connections to physicians where we actually make direct referrals right from our facility to the clinician. We follow up right away with them just to make sure that the connection is made.
We do the same as Collaborative Wellness, but also we have a grant where we can help anyone who might need MAT treatment. So we can fund the Traloxane, methadone, whatever it might be. And then we also have Narcan that is available for anyone just to take if they come in, no questions asked. So.
We also make referrals.
Okay, this is going to sound like a really naive question, but I'm going to ask it anyway. So I'm aware of Narcan, know what it is. You mentioned that there's supplies available on some of the tables. What I don't know is, even if I had it, would I recognize when to use it or give it to some? I don't even know how you administer it. So can you give it to somebody that isn't suffering from
You can.
overdose?
Yeah, absolutely. No, that's a really good question. So, a big thing is understanding Narcan and what it does, right? So, so there's lots of training that is available out there free of charge. We do some limited training and solutions, but there's also, like, if you have that We Heart You app, there's training right on there. There's a YouTube video that will link to Narcan training, and that'll show you some of the signs, symptoms. I don't need to get into like a whole training session here now, but what I can tell you is if you do carry Narcan and you suspect it, typically like an altered mental status or something like that, you're not going to hurt anybody if you give Narcan. Right. So that's one thing that's really important to know, is that it's not going to do anything except help in an opioid emergency. Even if it's suspected, it's better to give it than not.
All right, I think we have time. One more question? One last question? Okay, I think y'all just hear the noise out there and want to get to the snacks. Thank you so much for spending time with us. Thank you for caring. I learned a lot. I hope you did too.